Basic Wound Suturing by Concepcion Clarissa C. Materials needed: sterile gloves, towel clips, needle holder, pickup forceps, iris scissors, suture, local anesthesia, and syringe. Step 1. Infiltration of local anesthesia. Compute for the safe dose you can give the patient: 5 mg per kilogram lidocaine or 7 mg per kilogram lidocaine with epinephrine in 1:200,000 ratio. Reminder: anesthesia bottle is unsterile. Use ungloved hand when handling. Hold the syringe with a gloved hand and aspirate calculated amount. Lightly tap on the syringe to remove air bubbles. Position the syringe bevel up into the skin surface. Aspirate prior to injection of anesthesia to make sure no subcutaneous blood vessel is hit. Wait for 2 minutes and test if the anesthesia has taken effect. Step 2. Proper instrument handling. For instruments with finger holes, such as a needle holder, a tripod grip is recommended. For your pickup forceps, use a pencil grip. With your dominant hand, insert the ring finger and thumb into the finger holes while using your index finger to steady the instrument. Hold your forceps as if holding a pencil. Step 3. Loading of the suture needle. Pick up the suture needle with the forceps and clip it at 2/3 of its length with the tip of the needle holder. Reminder: never touch the needle with your hand. Step 4. Simple interrupted suturing technique. Approach one side with a needle 1 cm from the edge perpendicular to the tissue sutured. Gently rotate the wrist until the suture exits on the other surface, still at 1 cm from the edge. Adjust the length of the suture. Close with an instrument square knot. Reminder: tie the knot on one side to avoid disrupting the wound healing. Cut the excess suture with iris scissors on a tripod grip, leaving 1 cm on both ends. Finish suturing the entire length of the wound. Step 5. Testing the integrity of the suture. Using a Kelly forceps, insert the forceps with the curve up and pry open to check if the sutures will hold up. Thank you, and please subscribe to my channel.